globally, um, something like 15% of all the bad things that happen in hospitals, they're linked to surgery. Think about that. It's quite a stark reminder of the risks involved, isn't it? And, our minds immediately jump to the surgeon, the skill level. But what if I told you that making surgery truly safe and effective, well, it goes way beyond just the person holding the scalpel.
You're absolutely right, and that's exactly what we're digging into today. This deep dive is all about surgical quality improvement, or QI. We've pulled together insights from, well, several key places. You've got the big global players like Joint Commission International, JCI, and ISQA, the International Society for Quality in Healthcare. Then there's the national view from India's NEBH, some practical advice from consultants like Supremedic,
Yeah.
and even perspectives from surgeons who are actually doing this QI work on the ground, from articles and podcasts.
Okay, so we're looking beyond just, individual brilliance. Our goal today is to explore how this whole system-wide approach, thinking about the team, the room, the tech, is really changing surgery for the better. We want to break down what surgical QI actually is, why it's so crucial, and what the key elements and benefits really are. So consider this your fast track to getting a handle on a really vital part of modern healthcare.
Okay, let's unpack this. What exactly is surgical quality improvement?
Well, in essence, surgical QI is about consistently getting the best possible results for every single patient having surgery. It's a proactive effort, minimizing variations in care, cutting down errors, making processes more efficient. And a really big shift here, as you mentioned, is moving away from focusing only on the surgeon's individual skill. And that skill is obviously vital, but QI recognizes that a whole bunch of connected things impact the patient's journey and outcome.
So less like focusing on a star quarterback and more on the whole team, the plays, even the stadium conditions. Exactly. That's a great analogy. It's what we call a systems approach. It includes everyone involved, surgeons, yeah, but also nurses, anesthesiologists, techs, support staff, the whole crew. And it looks at the environment itself, the OR layout, how the equipment works, even things like lighting and temperature. And like one of our sources, podcast transcript, really stress QI isn't a one-and-done thing. It's this ongoing proactive cycle. You're always evaluating, always trying to improve. It's very different from just, looking back at mistakes in an audit.
Right, proactive, not just reactive. Now, some people listening might think, hang on, we follow evidence-based guidelines. Isn't that enough for good surgical care? Why do we need this? This extra layer of quality improvement?
That's a really fair question. And the truth is, even with solid evidence guiding practice, you can still get what we call unwarranted variations. Basically, differences in how that evidence is applied in the real world for no good reason. Imagine two people needing the same common operation, like an appendectomy. Even with clear best practices, they might get slightly different timing for surgery or different antibiotics or differences in post-op care. QI tries to iron out those inconsistencies, making sure every patient gets the most effective evidence-based care we know how to give.
Okay, so it's about making sure the best way we know actually happens reliably every single time.
Exactly. And when you look at the bigger picture, patient safety is it's paramount in surgery. Our sources really hammer this home, the critical role QI plays in actively preventing those adverse events, the serious, sometimes devastating complications. And the cost of these complications, both the human suffering and the financial burden on the system, it's huge. So having a systematic way to minimize these risks isn't just nice to have, it's essential.
Okay, I get the why. So how does this actually happen in practice? What are the core principles? The actual actions.
Right. So there are several key principles. A big one is data surveillance and standardization. This means you're systematically collecting and analyzing data. What procedures are happening? What are the outcomes? This lets you see where the problems are and track if your changes are actually working. And tied very closely to that is standardizing processes, setting up clear protocols, guidelines for how things should be done. This reduces that variability we talked about, makes things more consistent, more reliable.
So data points you to the problem, and standardization gives you a consistent fix.
Pretty much, yeah. Then another key area is optimizing the surgical environment. This isn't just about keeping things clean, though that's important. It's also about ergonomics, like how is the OR set up? Is the equipment designed to help the team work efficiently and comfortably? Reducing fatigue, awkward movements, that helps prevent errors. It also looks at the whole flow of the surgical space. And then there's a huge focus on enhancing communication and team performance. Surgery is definitely a team sport, even with a lead surgeon. So clear communication, good collaboration, everyone coordinated. That's absolutely critical to avoid misunderstandings and keep things running smoothly and safely. And kind of underlying all of this is systems thinking. understanding how all these pieces, the people, the place, the processes are all connected, how they influence the outcome together. You can't just tweak one little thing in isolation. You have to see the whole picture, like a complex machine, right? All parts need to work together.
Okay, those principles make sense.
Yeah.
Now, can you give us some real-world examples? How does this translate into actual projects or changes we might see?
Absolutely. And the sources gave some great examples. One of the most powerful and maybe most familiar is the use of checklists. Standardized surgical safety checklists, the WHO surgical safety checklist is the famous one, mentioned everywhere. They make sure essential steps get done at critical points, before anesthesia, before the first cut, before the patient leaves the OR, and the impact. It's been genuinely dramatic. Studies show they can cut mortality by up to 40% and complications by 30, even 50%. It seems simple, maybe, but in that high-stress OR environment, it's a vital safety net. Make sure nothing crucial gets missed. We even saw a specific case from AIMS Delhi. They improved checklist use and saw a significant drop in surgical site infections.
Wow, that's huge for such a seemingly simple tool.
It really is. It shows the power of standardizing to prevent basic human error. Another key practice is surgical team briefings, short huddles before starting. The whole team runs through the plan, flags potential issues, confirms everyone knows their role. That proactive chat prevents a lot of mix-ups. Then you have technology advancements, things like robotics, navigation systems. They can boost precision and safety for certain operations. And data-driven improvement programs like NSQIP, the National Surgical Quality Improvement Program. These let hospitals track their own surgical outcomes, see how they stack up against national benchmarks, and pinpoint areas needing work.
So it's not just internal data, it's comparing yourself to others too, learning from the best.
Exactly. That benchmarking is really powerful. It helps identify best practices and where you might be falling short. We also see surgical site infection, SSI prevention bundles. These are like packages of proven steps, specific skin preps, keeping the patient warm, giving antibiotics at the right time, all bundled together to cut infection risk. The podcast transcript we looked at mentioned a really impressive 35% drop in SSIs for colorectal surgeries just by using a bundle like that.
35%.
Yeah. And another big one is ERAS protocols, enhanced recovery after surgery. These are really comprehensive plans. They start before surgery, getting the patient optimized. Then specific things during the op and afterwards, focusing on early movement, tailored pain control. The Royal College of Surgeons has really pushed ERAS, and it's proven to cut down hospital stays and complications. It's a real systems approach. And finally, don't forget morbidity and mortality M&M conferences. When they're done right, focusing on learning, not blaming, they're incredibly valuable. Digging into the root causes when things go wrong. Creating that psychologically safe space is key, so the team feels okay discussing errors openly and figuring out how to stop them happening again.
These are all fantastic, concrete examples of how this systematic thinking leads to real benefits for patients. Now, you mentioned JCI and NABH earlier. How do organizations like these drive the adoption of surgical QI?
Right. So JCI, Joint Commission International, is a major global player in healthcare quality and safety. Their whole mission, they say, is to enable and affirm the highest standards. They set these really rigorous international standards and accredit hospitals worldwide. Our info showed over 1,000 programs in, 70-plus countries are JCI accredited or certified. And what's interesting is that the process of going for JCI accreditation, it basically forces hospitals to implement these QI principles. One hospital administrator actually called it a fantastic team-building exercise because it improved coordination and communication so much.
So just aiming for the accreditation itself makes organizations adopt these better practices. It's not just about getting the certificate at the end.
Exactly. It gives them a clear roadmap, define goals that line up perfectly with surgical QI. And similarly, NABH, the National Accreditation Board for Hospitals and Healthcare Providers, does this for India. It's part of the Quality Council of India, setting benchmarks specifically for the Indian healthcare system. So getting accredited by bodies like JCI or NABH, it essentially provides the structure and external push for hospitals to get serious about surgical QI and keep it going.
Okay. And what about ISQA, the International Society for Quality in Healthcare, where they fit in?
Yeah. ISQA is a bit broader. They're a nonprofit, been around over 30 years, focused on promoting quality improvement in healthcare globally, full stop. Their work involves education, sharing knowledge, evaluating systems, supporting health systems. They're like a global hub. They connect professionals worldwide who care about quality and safety. So when you think about our topic, surgical QI is obviously a huge piece of overall healthcare quality. ISQA's work across the board naturally supports and promotes promotes better surgical QI strategies internationally. They help spread best practices and new ideas in surgical safety.
Got it. So there's definitely a strong global movement pushing for this, but as you hinted, putting it all into practice, it's not always easy, is it? What are some of the roadblocks people run into?
You're right, implementation definitely has its challenges. A big one can be resistance to change, especially among surgeons. I mean, surgical training traditionally emphasizes individual skill, autonomy, so shifting to more standardized, system-focused ways can sometimes face pushback. Time pressure is another huge factor. Surgical units are incredibly busy. Surgeons, nurses, everyone might feel like they just don't have the bandwidth for another initiative, even a valuable one like QI. Then there's the practical issue of data. In some places, you just don't have good systems for collecting data reliably, or maybe the electronic medical records aren't quite there yet. That makes it hard to track progress. And crucially, lack of leadership buy-in. If the hospital administrators aren't fully behind it, aren't allocating resources, even the best QI ideas can fizzle out.
Right. You need that top-level support.
Absolutely. And getting everyone involved, not just the surgeons, nurses, residents, they often see problems firsthand and have great ideas for solutions. Multidisciplinary engagement is key.
So given those hurdles, how can a surgical department actually get started? How do they begin building that QI culture?
Yeah, the podcast transcript had some really practical first steps.
Right.
The advice was basically start small, show it works, pick a manageable area to focus on first. The example given was streamlining pre-op fasting time, something concrete, then collect some baseline data, even just for a few cases to see where you're starting from. Form a small, multidisciplinary team. Get nurses, maybe residents, anesthetists involved. Different perspectives are good. Then use a PDSA cycle, plan, do, study, act. It's a simple framework. Make a plan, try the change, study the results, act on what you learned, test and refine. And finally, super important, document and share the results. Show people in the department that this effort actually made a difference. That builds buy-in and momentum. And of course, leverage the tools already out there, like the WHO checklist or programs like NSQIP if they're available to you. Don't reinvent the wheel entirely.
Start small, involve the team, measure, share the wins. That sounds very doable. Looking forward now, what's on the horizon? What does the future of surgical QI look like?
Well, the expert on that podcast pointed to some exciting trends. We're likely going to see more integration of AI and data analytics. Think sophisticated models that could predict a patient's risk of complications before surgery even starts. Also, video-based assessment of surgical technique. Using recordings to help surgeons refine their skills, standardize best practices could be a powerful tool. And a growing emphasis on patient-reported outcome measures, or PROMs, making sure that our definition of quality truly includes the patient's own experience of their recovery and well-being. That's crucial. Plus the continued growth of national surgical registries. More data means better benchmarking, better understanding of trends on a large scale. The bottom line seems to be that QI won't be seen as some optional add-on anymore. It's becoming a core fundamental skill in surgery.
Okay, so wrapping this up, surgical quality improvement, or QI, it's really about shifting focus, moving beyond just the surgeon's hands to build these robust, data-driven systems, systems that support the whole surgical journey to make it safer, make the outcomes better for every patient. And organizations like JCI, NABH, ISQA, they're vital in setting the standards and really embedding this culture of constant improvement in surgery worldwide.
Exactly. And it leaves us with some interesting things to think about, doesn't it? Like, with surgery getting more complex, how can patients themselves become more informed, more active participants in ensuring they get the highest quality, safest care? And another thought, with this increasing reliance on data, on tech, on systems, what does that mean for the role of the individual surgeon moving forward? How does their expertise fit into this increasingly systems-driven world? These are big questions as the field keeps evolving.
Definitely food for thought. Understanding these systemic approaches, though, it really does give you a valuable insight into how high-quality healthcare actually happens.